Dr. Zayd Eldadah. I'm Director of Cardiac Electrophysiology at MedStar Heart and Vascular Institute. And I see patients and do procedures at MedStar Georgetown University Hospital, MedStar Washington Hospital Center, and I see patients in the community at a number of sites, including sites in Fairfax, Virginia, Arlington, Virginia, Reston, Virginia, Wheaton, Maryland, and also Frederick, Maryland. My specialty is known as cardiac electrophysiology, and that's a subspecialty of cardiology which focuses on the electrical aspects of heart health. That means primarily heart rhythm. So I see patients who have problems related to their heart rhythms being too slow or too fast or out of sync, meaning irregular. And each of those problems can cause actual health consequences, and it's our mission to try to identify the problems and correct them. MedStar Heart and Vascular Institute is an extraordinary organization because it combines and brings together experts in heart and vascular care who are truly leaders in their field, all under one umbrella, all in the nation's capital. Our care, we believe, is superior because we're focused on heart and vascular issues, and that's what we do. And our clinical volumes have been very high for a very long time, and with volume comes experience. And over the course of time, when you collect people who do nothing but heart and vascular work, who work together, who actually are some of the pioneer researchers in this field, you can create an extraordinary organization of people focused on heart health. We take care of patients that many other facilities just can't handle. We're the organization that has to say yes when others say no. I want my patients to know that when they walk through our door, nothing else is more important than their well-being. We approach every patient as we would our own family member. We'll only do a procedure if we think that's truly in the best interest of the patient. Oftentimes, we decide and elect not to do a procedure because that is in the best interest of a patient. I love coming into work every day, working with wonderful people who are all very dedicated professionals. They love working in this environment. They love taking care of patients. And what we always tell each other is that our true boss is our patients. We like to help people. We want to help people. A cardiac electrophysiologist is a cardiologist who has done special training and has spent extra time focused on heart rhythm. The heart, as you know, is both a magnificent pump, but it's governed by or run by, managed by an electrical system. It's actually a very complex, but in essence very simple system that manages the pump function of the heart. So electricity is what underlies heart muscle function, and we're the specialists in that electricity of the heart. The heart doesn't just beat on its own, it beats because there's electricity that travels within the heart in a very organized way, so that the heartbeat itself is a very organized, nicely choreographed sequence of contraction of the upper chambers of the heart and the lower chambers of the heart. The timing has to be right, the contraction has to be right, and if any of those things goes off, there can be health consequences. One very classic problem in our specialty is when the heart's electrical system is too slow or is interrupted, meaning that it doesn't move from one chamber of the heart to the other in the right time. And when that happens, the heart rate can become very slow. And that's kind of like your car engine losing power. You press on the gas, but it doesn't move. In a human being, what that translates to is feeling tired, feeling dizzy, sometimes feeling short of breath, feeling unable to do even simple household activities. In some cases, it can mean passing out. That can be corrected in a very simple way by fixing the heart rhythm, by identifying where the problem is and correcting that problem. The most common heart rhythm abnormality seen in human adults is known as atrial fibrillation. And that's probably one of the most common conditions that we see and treat in our specialty. But we also treat patients who have slow heart rates, and slow heart rates are problems that often occur in the elderly, but sometimes can happen earlier in life. We also see a very common problem, or a very common category of problems, and that's known as sudden cardiac death or risk for sudden cardiac death. And what that problem is when the heart suddenly, rather than beat, suddenly starts to quiver uncontrollably and no longer pump adequate blood flow to the heart. That can immediately lead to dizziness, lightheadedness, passing out, and if it continues, to irreversible death of the patient quite quickly and suddenly. It's one of the most catastrophic things that we see. It's alarmingly common, but thankfully we have techniques and strategies and therapies to prevent it from happening. There are many ways that we can identify risk, but interestingly and to some extent, sadly, we don't know all the ways. One of the classic risk factors for sudden death is having weakened heart muscle. So anybody who has a heart that is not pumping as strongly as it should, because, for instance, that person has had a heart attack in the past, or that person has some heart muscle disease, potentially, for instance, because of exposure to some toxins or chemotherapy drugs or other illnesses, weakened heart muscle predisposes to that rapid, sudden quivering that leads to sudden death. So that's a very important point. Another very important risk factor is a family history. So if one comes from a family in whom, for instance, a brother or an uncle or a parent died suddenly, that raises the alert that perhaps there's a problem there that needs to be looked into. Heart failure is when the pumping function of the heart is inadequate to meet the body's needs. And there are many reasons why people get heart failure, but the particular area in which we as electrophysiologists help our colleagues who are purely focused on heart failure is in the area of heart rhythm function. Because when the heart rhythm is disordered, and a pump is already weakened, that weak pump can become even weaker. It's very important for the synchrony of the heart, meaning the contractions of the heart, to be in sync in order for the pump function of the heart to be maximally effective. In atrial fibrillation, the heart contraction, instead of being regular and rhythmic, is irregular and erratic. And when that happens, again, the pump function becomes much less efficient. It's kind of like when your car engine is knocking. It's not going to move very efficiently. What we can do is we have a number of strategies to treat atrial fibrillation and restore that rhythmic, elegant contraction cycle of the heart and lessen the features or symptoms of heart failure. We are privileged here to offer a very potent tool for those patients, a very good therapy, and that's known as convergent atrial fibrillation ablation. What that means is that an electrophysiologist and a cardiac surgeon converge together on the patient to address the atrial fibrillation by attacking it from the outside of the heart and the inside, both at essentially the same time. The cardiac surgeon will make a small incision under the breastbone and get access to the heart and do the procedure to ablate the tissue from the outside, to recognize where the atrial fibrillation signals are coming from and treat them that way. Then that surgeon closes his incision, removes his equipment, and the cardiac electrophysiologist comes in to do his or her part of the procedure, which is to address the heart's atrial fibrillation problem from the inside of the heart using a traditional catheter tool, and to make sure that all the work that needs to be done is done. It's a very effective tool and has offered great relief to patients who haven't gotten that relief by other traditional methods. A pacemaker is a device that is implanted in a human body, typically just under the collarbone, that has a wire or two or sometimes even three that are threaded through a vein in the chest, and of course veins lead to the heart, so that's the conduit by which the wires are delivered to the heart. Wires within the heart are able to sense and actually pace, meaning trigger a small electrical impulse that leads to heart muscle contraction, all controlled by a computer that's implanted under the collarbone. So that whole system is known as a pacemaker. And what a pacemaker is used for is when heart rhythm is typically slow, or there is an interruption in the electrical conduction from one side of the heart, or the top of the heart, to the bottom of the heart. A pacemaker can correct all of those problems. A defibrillator today has all of the features of a pacemaker like we just described, but an added feature to recognize when the heart's ventricles, which are the bottom chambers of the heart, the thick muscular portion of the heart that actually contracts and delivers blood to the body, when those chambers suddenly become out of whack, when they start to quiver rather than contract. So it's very important for our pump to actually be squeezing nicely to actually propel blood through our bodies. But imagine if all of a sudden that muscle, instead of squeezing or pumping, suddenly just starts to quiver. Blood doesn't move at all, and there's no blood flow to the brain, to the body. A patient will rapidly collapse and potentially will die if that's not corrected. A defibrillator is able to detect that when it happens and do something about it. What a defibrillator typically tries to do is first pace the heart out of that fast rhythm so that the patient will, without even knowing it, will suddenly be revived and not have a problem at all, not skip a beat, if you will. If that doesn't work, the defibrillator is smart enough to know that it needs to do something drastic, and what it will do next is shock the heart. It will deliver a big pulse of electricity, and that energy that goes to the heart is kind of like switching it off and on, resetting the heart completely so it starts to beat normally again. The implantation of pacemakers and defibrillators is technically an outpatient procedure. It's considered minimally invasive medicine, meaning that there's not much invasion of the body done, simply a small incision, a small pocket under the skin, and basically IVs placed in a vein to deliver the wires. What we typically do, however, is keep patients just overnight to receive antibiotics and to observe them to make sure that they're feeling okay and that there aren't any problems like bleeding or discomfort before they can go home. But typically patients go home the very next morning and resume their lives that particular day. We ask patients to forget about the device. Consider a defibrillator a guardian angel that's just within you, watching over your heart, and able to be called into action should you need it. Consider your pacemaker very similarly. It's a device that, should your heart need extra help in beating, the pacemaker can give it. Otherwise, we want patients to resume their full activities with a simple small exception, and that is that for the first few weeks after the device is implanted, depending on what side the device is implanted, we ask that that arm's motions be a little more restricted. We don't want, for the first few weeks, the arm to be flailing wildly or swinging, because that can tug unnecessarily on those freshly implanted wires. But after those few weeks have gone by, we tell patients they can do anything under the sun that they were doing before, and hopefully they'll be doing it better. One of the classic problems that we see in our specialty is patients who have had palpitations, meaning they feel like their heart suddenly races or feels like a fish is flopping around here and there once in a while. Maybe over time, those episodes become more frequent or more longer lasting or even more severe. Sometimes patients don't seek medical attention for those problems. Sometimes, sadly, when they do seek attention, their complaints are sometimes even dismissed as being nervousness or stress or workplace problems, and the advice may not always be on the mark. We would advise patients like that to get evaluated, because sometimes those are symptoms of a very easily treatable condition that can be cured using techniques of cardiac electrophysiology. Ablation simply means destruction of tissue. And you might ask, well, what does destruction of tissue do? In the case of our specialty of cardiac electrophysiology, the destruction is a very tiny, focused amount of destruction simply of heart tissue that's causing a problem. And the delivery of that energy and the destruction of the tissue itself is known as catheter ablation, because we deliver the energy through a catheter and we can ablate or destroy that small area of abnormal or abnormally functioning tissue by either heat energy, which we call radio frequency ablation, or freezing energy, which we call cryoablation. Many ablations that we do in our specialty are truly outpatient procedures, meaning that you would come into the hospital, enter the procedure room, often be sedated so you're comfortable and kept calm and happy. Local anesthetic is given at the site of a large vein, typically in the thigh. Catheters are delivered through the heart. Catheters are long, thin plastic tubes, generally with small metal endings, that are delivered under X-ray guidance to the heart. And we can use some very sophisticated high technology tools to make sure that those catheters travel in just the right place and are used to find the sources of the abnormally functioning tissue, and the tissue can then be ablated. The catheters are removed when the problem is solved. There's a little bit of pressure held on the vein to make sure it doesn't bleed. You'll sit in the hospital bed, generally with your leg straight, for about 4 hours. Then we have you get up, walk around, eat a meal, make sure you're feeling comfortable, and you go home. That's how a typical ablation actually works. The biggest obstacle to good heart health is excess body weight. It's such a problem. Obesity is a huge problem at so many levels. In our particular specialty, having excess body weight puts a huge load on the heart and actually promotes many heart rhythm disorders. And in addition, it can make those heart rhythm disorders much harder to treat. There are a number of lifestyle modifications that are important in the field of heart rhythm disorders and in cardiology in general, and they're the kind of advice that your mother would tell you. Don't drink too much caffeine. Keep alcohol intake moderate. Don't overeat. Get exercise. Live a healthy life. Don't be overweight. Take care of yourself. Take your health seriously. Make sure you follow up with your physician. And if you have symptoms, even if you think they may not be something significant, make the effort to get them checked out. There are many conditions in cardiology and also in cardiac electrophysiology or heart rhythm disorders that are genetic, meaning we know very well that that disease or that disorder is inherited from parent to child. We have at MedStar Heart and Vascular Institute a very capable cardiogenetics program that specializes in these disorders and in conditions that may not have been previously described, but in which patients let us know that other family members have had problems similar to theirs, and we can do genetic counseling, we can do genetic testing. Believe it or not, atrial fibrillation in some families is a purely genetic condition. There are other conditions known as long QT syndrome, which is an abnormality of the electrical function of the heart that may make patients at risk of sudden death. There's other conditions known as Brugada syndrome and other kinds of inherited electrical abnormalities that lead to cardiac problems in patients that can be detected, tested for, and assessed in other family members. Congenital heart disease is a condition in which the heart muscle itself forms abnormally in a fetus before the child is born. And it can create many problems for the youngster soon after birth or in early childhood. Often many of these conditions are able to be corrected surgically. But one of the problems with surgical corrections of heart malformations is that the actual act of doing a surgery on the heart can create heart rhythm problems down the road. Anytime heart muscle tissue is cut into or sutured, as would be done in the case of correcting congenital heart disease, those sutures and incisions can actually later on be the sources of heart muscle electrical abnormalities and heart arrhythmias, short circuits that spin around the scar tissue, for instance. Our specialty focuses in part in dealing with children and adults who have had congenital heart disease. And in our section here at MedStar Heart and Vascular Institute, we're very happy to have one expert who's trained in both children and adults who focuses exclusively on these conditions of congenital heart disease and repaired congenital heart disease, and correcting the heart rhythm abnormalities that can result.